Thank you. There are thousands of people living with sickle cell disease in Louisiana. The disease, of course, comes with a host of problems, including anemia, pain, and frequent infections.
So for folks living in rural areas, it can be hard to find what they need to treat their symptoms at home. Our Liam Combs is here to explain how lawmakers are hoping to change that. Hey, Liam.
Thanks, guys. Roughly 80 infants are born each year in Louisiana with sickle cell disease. This problem is especially common in the African American community. A task force at the Capitol is working on making sure treatment is readily available, especially in rural areas. Right now, Medicaid does not cover at-home health care for sickle cell patients.
The parishes over towards the Mississippi border, Louisiana-Mississippi border, and the northeast corner of our state, we continue to see many more health disparities in those parishes. And we do think that that is because those individuals don't have easy access to care.
In the 2025 legislative session, some lawmakers are hoping to expand Medicaid coverage to sickle cell families so they can get what they need to manage their symptoms at home, with things like 24-hour vital sign monitoring and IV drips.
Getting resources for the home, having those well checks, I think is going to help to avert some emergency room visits and have better outcomes for our sickle cell families.
Dr. Karen Weibel with the Task Force on Rural Healthcare Access says sickle cell patients should not have to go to the ER in order to receive the treatment they need. And most importantly, it's not just about the pain meds.
Sickle cell disease is not a pain management disease. It is a debilitating disease that affects every major organ in the body.
Sickle cell disease creates other health problems like strokes, mainly in children. Making sure families have what they need to manage these health risks is a big part of this initiative.
So we do have hope, and I think we're doing a better job of giving those patients hope.
There actually was a bill that passed the House this past May, but it got held up in a Senate committee right before the end of the last legislative session. You can count on seeing this bill on the agenda starting April 14th, 2025.
All right, Liam, for us tonight. Thank you. Appreciate it.